prescriptions. Okay, so prescriptions are important because a lot of people think that doctors write prescriptions, and that's just not true. You do. All the doctor does is sign it, right? So you have to be able to fill out a prescription and have it ready for them to just sign, right? Because a lot of doctors, they're just too busy to write prescriptions. Now, back in the day, you used to have a log, right, or a pad of prescriptions, and you write it and you tear it off and you give it to the patient. Today what we do is we print it out. When you print out a prescription, it cannot be on regular paper for certain types of drugs. Okay, it has to be on a certain type of paper so it can't be replicated. So let's talk about it, okay? So there are different variations of drugs. So we call them scheduled drugs. Scheduled drugs 1 through 5. And we use Roman numerals to number these. So Roman numeral 1 is I. Roman numeral 2, 2 I's is 2, 3 I's is 3, and then an IV is 4, and V is 5, right? So that's the scheduled drugs that we're going to talk about. Now, there are certain drugs that a dentist can prescribe, and there are certain ones that we can't. Schedule 5 is the lowest. It's different because it's kind of backwards. You would think 5 is high, right? That's a higher number, it's a high abuse. It's not. Schedule 5 is the lowest abuse level, and the reason we, we describe drugs and abuse level is because it's honestly it's a huge pandemic right now of people who are abusing drugs and getting addicted to them. So in the medical field in general, we are not trying to give patients drugs just to give them drugs. We want to try and give them the lowest amount of drugs possible so that we don't get them addicted on it. Okay, so if we can at all possible, we want to give them a Schedule 5 drug. An example of that is going to be like cold medicine over the counter, where you go to the pharmacy and say, hey, I need some cough syrup. They would talk to you about it and which ones to buy, which ones not to buy, whatever, and you can get it over the counter. Usually you don't need an ID or anything like that to buy cough syrup, but you can abuse cough syrup, right? But it's not a high abuse level, okay? And by abuse level, I mean by taking drugs just to get high. That's abuse, okay? It's not taking the drugs for the pain or taking the drugs for the antibiotics or whatever it is. If you're abusing a drug, you're taking it just to get high. That's the abuse level. So as we go up from 5 up to 1, the abuse level gets higher, higher, and higher, okay? So the lowest level is 5, which is like the cough syrup. Then you have 4, which is like, Schedule 5 is usually a drug that you can get refills on, and I can give you ahead of time. You can have a couple of them available when you need them. One that we use is Valium, which is basically a medication that we give patients to help them calm down if they're really nervous about coming in for the dentist or they have high anxiety, things like that. It kind of mellows them out a little bit. So Valium is really nice, and we don't give it to all patients. These are just for patients who have high anxiety and who need it, right? But it doesn't have a high abuse level for even Valium. It really doesn't. So it's just a little bit higher than what the cough syrup would be. So that's why it's a Schedule 4. Up from that would be a Schedule 3. This would be your abuse level starts to pick up now, right? So 3 and up, the abuse level is pretty high, and we don't want to give you anything from 3 and above unless it's warranted for that, right? So if you don't have pain, like if your dad takes Oxycontin, which is a level 1 drug, then you have just a twink in your neck or something like that. You're not going to take Oxycontin for something so little, like that is a large drug meant for other things. So level 3 is the lower end of the abusive drugs. So you can do like Vicodin is a pain medication, and it does help with pain, but it's the lower dosage. But then you can also get Vicodin with a higher dosage, and then it moves up from a level 3 up to a level 2, right? So you can get the same drug and it be listed under 2 or even 3 of these lists, but it just depends on the dosage. The way I like to explain it is kind of like, your Kool-Aid, right? When you make Kool-Aid, you can either put a ton of sugar in it, right, and then it's really bad for you, or you can put a little bit of sugar in it, right? Or your coffee drinkers, right? If you're gonna put a lot of sugar in it, it's really bad for you. Or if you're gonna put a little bit in it, it's just a little less. So it depends on how much of the medication is in the pill, okay? So Vicodin, you can also do Tylenol with codeine in it. That is very helpful for swelling, fevers, and pain. So like a lot of tooth pains, we like to do that as well. The problem with that is that it's your job to make sure that they know there's Tylenol inside that drug. So that is 2 drugs mixed together. All right, so it's really, really important that they know that they cannot take Tylenol and this pain medication because they can actually overdose. Okay. So you want to make sure that you let them know that. Once you get to level 2, that's when you're going to get into your Oxycontins and your higher levels of your Vicodin and stuff like that. Again, those are both pain medication. I've only seen a dentist ever prescribe Oxycontin about 1 time in my whole career, and it was very, very strange. It's not something you normally see. So because it's such a high drug, typically we as dentists stay in the level 3. Typically this is where we're at, okay? We don't go into the Schedule 2s or the Scheduled 1. Schedule 1 is heroin, all right? So those are drugs that we don't really prescribe and that are very, very, very abuse oriented, so you can get addicted to that very, very quickly. Let me turn that back on. There we go. Okay, so you can see how the level of the drugs kind of go up. Again, we try to stay in the 2 or 3 area. That's usually where we're at. If at all possible, we can give you ibuprofen instead of pain medication. We will. We want to. And it really depends on the level of pain and kind of how the doctor is understanding your pain and things like that, or what they're going to prescribe. So these are the different types of drugs. All of these are monitored. As of a few years ago, there's all of your pharmacists are going to keep up with it. So if you have a patient coming in with a Schedule 2 drug and a Schedule 3 drug for 2 or 3 times a week, they're going to flag the account and they will not prescribe the medication for them. So it is looked at. If there is a doctor who's constantly prescribing like a level 2 drug for over and over and over and over again, they will be looked at and they can potentially lose a license and things like that. So it is really important that we stay within the what the medication is going to do for the patient, right? Giving someone Oxycontin for a toothache and things like that does not really warrant the medication, so you want to make sure that you're giving the correct amount for the patients. Again, that's not your job, but you do need to understand why your doctor is choosing to make these decisions and be able to explain it to your patients. So if you have a patient come in who got Vicodin yesterday and they come in and say, I'm out of Vicodin, I need more, and your doctor says, no, I can't give you any more, that is why. Because there's a certain amount we can give you, and if you hit that amount and you are constantly coming back for more and more pain medication, it's no longer for the toothache, it's more likely for the abuse and things like that, which your doctor can get in a lot of trouble for. So they are very stingy these days on medications. And most of them will give you ibuprofen unless it's like, extreme pain and stuff like that. So just, again, you don't need to know all of these, but I want you to have the general idea of why your doctor might tell a patient no, and that is why. Okay? So this is what a prescription looks like. So most of the time what you're going to do is you're going to type it in the computer and it's going to spit it out for you, but you need to know what is on your paper and what to look for, okay? So the first one is up on the upper left. This is the doctor's information. This is where your office is located, the office phone number, your doctor's name, their credentials behind it. Dr. Smith is a doctor of dental surgery. So that's what DDS is. Has the office number and the address of the office. Now, below that, you're going to have the patient's name here. So if you're going to have a patient of put their name here. You're going to put their address here. So whatever their address is. Their age is really important. If they're underage, they have to have, you know, other standards to think about. But let's say this person's, you know, in whatever, today, I'm not sure what is today. We'll just say, probably not today's date, but can't think about it. So you're going to fill in the patient's information. Most of that is already going to be filled in for you in the computer because their information's already set in there. So you won't even have to really fill that out. But you need to know that the doctor's information is here, and then the patient's information is going to be here. Now, why do they need the address? Why do they need the address? Because when they go to the pharmacy, they have to confirm that you are the patient that we are giving this prescription to. So they are going to confirm the address, they're going to confirm your birth date and your age, and you know, your insurance if you have it, things like that. That's why that's so important. Okay? Now the next thing is you're going to put the drug information down here. Alright, so your doctor says, go ahead and write up a prescription for Vicodin 500 milligrams, 12 tablets, right? So you're going to write the drug name, Vicodin, the milligrams, right? So 500 milligrams, okay? So this tells me how strong it is, okay? So Vicodin 5s or Vicodin 10s, okay? Vicodin 10s are stronger, and we typically don't give out the larger amount. It's usually the smaller amount that we want to give you. It's, you know, again, it's still a really good pain medication. I'm just saying that there are higher levels that we could give out, and we reserve those for very specific reasons. And there's also 7.5s and stuff like that too. So just make sure you know what milligrams that you're going to give them. Dispense is how many, okay? So for Vicodins, I'm going to give you 12 pills, right? So that means you're going to get 12 pills in the bottle. That's important because they need to know how many to put in there, all right? So this is the drug itself, then how much is in the bottle, right? And then you're going to put the instructions here. The instructions are important. You don't have all day to write out your prescription instructions. So we talk in short terms. Think of it like texting, right? If I write LOL, what do I really mean, right? I really mean laugh out loud, right? Or lots of love, however you want to take it. If I put BRB, I really mean be right back, but it's a quick way to talk, right? So you're not going to write out all of your instructions here. You're going to use short terms to, you know, to kind of discuss it with the pharmacist. This does not go to the patient, right? This goes to the pharmacist who is reading this instructions and giving the prescription to the patient. So this doesn't need to be in the patient's terms, it needs to be in the terms of the pharmacist, okay? So in this example, it says to take 1 to 2 tabs, Q means every, 4 to 6 hours, PRN means per pain, okay? So you can take 1 to 2 tablets every 4 to 6 hours per pain. So if I have 12 tablets, that's going to last me 2 or 3 days, right? That's going to last me just a few days. So if I give you 12 tablets today, and then the patient comes in tomorrow and says, I'm all out, they abuse the drug because the instructions told you to do it that way. Does that make sense? I hope that helps a little bit, okay? Here is just some quick things. These are the most common terms that you're going to see. Excuse me. So BID is twice a day, Q again means every, and then QD is once a day, QID is 4 times a day. Again, PRN means per pain. If you don't have to take it, it's just if you're in pain, then you can take it. But the soonest you can take it is every 4 to 6 hours. Okay. Down here it says substitution, right? So there are general, brand names. So you can get like the really nice OxyContin big ones, and then you can get like an off-brand. So think of it kind of like your Walmart brand, and like your disinfectant wipes are Lysol, right? But then you can get the Walmart brand disinfectant wipes, right? So it's the same thing, it just has a different name on it. So if the patient says, oh, like let's say Vicodin is $30 for this prescription, but in the substitute of Vicodin, I can get it for, $15, right? So you can give that option to the patient and you need to check that off as the doctor if you want them to do that or not. So that's what substitution means. So if it's permitted, you'll put it there, meaning, hey, if there's another general drug just like this one but in a different brand name, absolutely give them that one, right? Usually antibiotics is the one that they don't permit. They want you to have a specific type of antibiotics that they know works really well. Pain medication, they can usually use the others, the generics, okay? So you're just gonna put, you know, an X here. The next one is a refill. This is a narcotic. So what a refill means is I got 12 today and I have 2 refills. If I have 2 refills, that means 2 more times I can come in and get 12 more. So altogether, that's 36 Vicodins I'm giving a patient. That is way too many. They don't need that many refills. Generally, especially with narcotics, you are going to put a big fat 0 on it, right? They don't get any refills for that, okay? So you want to make sure that all of that's on there so that we know if they can get more of it or if they can get the generic brand. Now, like Valium is one that you can give them refills for. Like if you know that they need a Valium every time they come into the dentist, you know, go ahead and, you know, give them 2 refills so that they have the prescription for the next visit and the next visit, you know. So you can do that, but then the higher up you go in the schedules, that's when it's going to turn into not permitted really quickly, okay? The last thing on here is the signature and the DEA number. The DEA number is just a bunch of numbers that is assigned to this doctor, right? And that is how we track what doctor is prescribing what things, and if they are abusing it and just prescribing it to prescribe it, or if we're, you know, using it for real things. So you got to make sure that the DA number is on there. And what you're going to do at this point, now that we have it all figured out, we're going to print this out. You're going to hand it to the doctor. The doctor is going to pick up the pen and they're going to chicken scratch it. Every doctor's signature looks just like that. It's just a bunch of squiggles. And then you're going to hand it to the patient. Now, again, you're printing all this out. You're writing this all up. The doctor's just going to say, hey, go ahead and write this one up and tell you what to write on there. But your job is going to be to print it out and to have it ready. Now, if you're going to use like these scheduled drugs, you have to put it on a certain type of paper. The paper, it has like a watermark on the back that proves that it's prescription paper, because anybody can just make a copy of it, right, and bring it in another time. So we have to prevent that, and that's why we have special prescription paper for any narcotics and things like that, so that somebody else can't duplicate it. Okay, so antibiotics they don't have to be on prescription paper. It can be on any paper, but narcotics definitely have to be on there. So this is just one example. It's not a real prescription at all. Your doctor is going to tell you how many milligrams and dispensing how much, and you know what your instructions are going to be. There are some medications that we want you to take with food, so sometimes you will add in the instructions to take it with food or without food. It really depends on your doctor and the prescriptions that he is giving, and he should go over all of that with you. But just remember that you are the one printing this out, and it is on the doctor's butt if this is wrong, but it is your job to cover your doctor's butt. So make sure you are filling it out properly and that everything is on there. All right, if you have any questions about prescriptions, just let me know. Otherwise, have a great day.